hope this morning session provided you a valuable information, and to further enrich the program, we now move to the next session. First, I cordially welcome a senior physician, diabetologist and a Siddha researcher, Dr.S.Shanmugam sir, to this esteemed session. Welcome, sir. I invite our Arangam Dr. sir to honor our chief guest, Dr.S.Shanmugam sir. I warmly welcome our next speaker, Dr. Shanmugam sir, who is a former reader in medicine at Rogers Dental College, Kavalkinere, Tirunelveli district. A senior academic with vast experience, he has made contributions to hypertension, diabetes, coronary heart disease, and translational medical research. He has served on national and international journal advisory boards and authored several scholarly publications. He is a recipient of the MSD Award of the International Society of Hypertension and a senior life member of leading professional medical bodies. And he is also a dedicated Siddha researcher and the translator of the Noilla Neri Siddha text, contributing significantly to the preservation and dissemination of traditional Siddha knowledge. It is a great honor and privilege for us to inviting you, sir.
To share some of my experiences related to cancer patients treatment and Siddha medical products. Basically, in spite of I am an allopathic physician, we started in 1988 at District Science Center, Tirunelveli Cancer Society, and we have conducted almost every month a preventive oncology program. Unfortunately, at that time, people are not very much aware about the need for oncology, 1988, and so not much of response, so we stopped with 6 months. In 1988, April 10th, I have conducted as a organizing secretary, cancer care in medical practice, and 110 doctors in Tirunelveli district participated, one-day full program. And we have even put the proceedings in a print and then gave to people. But still, oncology was in its unrecognized state during that time. But now, oncology is the primary problem in medical field, whatever may be the branch it is. And 30 years ago, Professor Maria Joseph sir, as surgical professor, he was here, and we had a discussion, and out of which, in Tirumular Maligai itself, we had around 30 to 40 students with Dr. Joseph Das, Dr. Chelladurai, Dr. Maria Joseph and myself discussed about medicinal plants in cancer treatment. Unfortunately, even in the first program, we were not able to come to any conclusion what may be the possibilities, and next meeting was not conducted. And at that time, only one book, Professor Kumarasamy, botany professor, actually published long ago about the medicinal plants and cancer therapy. That was a very good book, and I could get it from a public library, and I used to read it, and that was not very well recognized. But now, if you go into the net, definitely plenty of articles. I was even telling Arangam sir, we can even consolidate it and put around 100 pages to 200 pages booklet. That is the amount of work being done throughout the world, and not only that, even in our own Tamil Nadu. In Kanyakumari, in one arts college, they have conducted a program related to breast cancer and some medicinal plants. Even in Balaji Medical College, which I will show, about Semicarpus anacardium, about which I am talking, Serangotai, that drug was studied very well by a Madras group of researchers. So such is the vastness with which now people are looking into the Siddha medicine and other branches of medicine like Ayurveda and homeopathy. Next slide. So, combining various systems of medicine, especially Siddha system of medicine, will help to improve the survival and symptoms. The recent spending on cancer therapy, maybe any one of your relative would have been suffering from some form of cancer, and how the expenses are going on anywhere, everywhere. Even one of my close friends' wife has got multiple myeloma, and every week they are giving an injection which costs around 2.8 lakhs. Already they gave some 15 or 20, but still there is no what is called complete cure is not assured by anybody. Such is the amount of money being spent. With breast cancer, I know people have spent around 15 lakhs, 20 lakhs, but ultimately the result is a big zero. That's the problem. Even spending is different, but because we have got insurance and also people can afford to. But what is the net result? That is the thing which is very much baffling. In spite of people say I have survived, and there are a lot of survivors group, no doubt about it. You would have heard about the very famous Cancer Institute, Ayush, wherein the chief doctor, Dr.S.Shanmugam, she herself had breast cancer, and she died even after so much of facilities available. In Tamil Nadu, Cancer Institute, Ayush is one of the pioneer institute, not only that, very advanced center, wherein we have got what is called the final result is not absolute. Even you would have heard the former health secretary had a brain tumor, and within 1 year she died. So why I am telling is, in spite of so much treatment available and so much money are being spent, and what is the end result? More than 50% of the people we are not able to do much. That is we are at crossroads, and not affordable for ordinary citizen. Hence, this integrated approach will definitely help. In the era of oncology, incidence explosion. Now, cancer is there and cancer is everywhere. That's what there used to be in Bailey and Love. There is a quotation. There is pus nowhere, pus is there. That is subphrenic space. When there is a pus, it will not be revealed easily, and you will have to search for it. It is a Bailey and Love's quotation, which is a very interesting quotation. The same way, when in doubt, you go for oncology workup, and most of the time you succeed in finding a cancer, but unfortunately you are not sure whether you will be able to help the patient to the extent possible. Next slide, please. So, oncology is a broad spectrum of diseases. So, it is not a single disease. Solid tumors in breast, uterus, cervix, testis, urinary bladder, brain, thyroid, lungs. It's a long list. And blood-related cancers, leukemia. During our undergraduate days in 1971 to 76, there are usually 3 or 4 types of leukemias. But now, if you take into the book, there are more than 20 subclasses. So many things have changed in the nomenclature as well as in diagnosis. Then, lymph glands related cancers, lymphomas. That is non-Hodgkin's lymphoma and Hodgkin's lymphoma. Then skin cancers, which are not very common in our country, but it is very common in Australia. Melanomas are very common. And even in that, there is one condition, I am not remembering the name, but I have treated a patient from Madurai, what is called the localized cancer, but there is no spreading. Such a thing is also existing. And metastasis in various organs. This is a very important thing because even I remember one bank officer's wife who had breast cancer, but she presented with a fracture of the femur, and later they found out she has got a breast cancer. Because of that, secondarily she has got this fracture. So the metastasis presenting is very, very common in our patient population because of ignorance and not able to come to the doctors at the earliest for diagnosis. Next slide, please. Modalities of treatment. Morning, I think the surgical oncologist would have explained in detail, but for completion's sake, I am going through it because of certain things. Surgery, then radiotherapy, now target oriented. Previously, radiotherapy has got lot of side effects, but now specific target oriented radiotherapy is a very common thing. Most of the hospitals, everywhere they are having. Then immunotherapy. Immunotherapy was very much unheard of during 40 years ago. But now immunotherapy, plenty of drugs have come. Though it's costly, from rheumatoid arthritis to so many conditions, now the immunotherapy is the order of the day. And it's very difficult to remember all those names also, because all XIF it ends with. And testing for chemocompatibility. This is a very new information which I hope you would have explained. Nowadays it is like for urine culture what we do, urine infection, urine culture, then we identify the antibiogram and then give that particular drug. But the same way in chemotherapy, because of the costliness, now in Bangalore, Hyderabad, I think in Chennai also it's available. There are laboratories which charges around 1 lakh, and they tell you what drugs will be very much useful for your cancer treatment. This is a very new information because within 5 to 10 years only this modality is very well utilized in Indian conditions. Then using alternate medicines, Siddha, Ayurveda, homeopathy. Because people have got a negative attitude to this thing is a wrong thing. And there are a lot of advertisements which are also going on. Something are good and something not good. For example, a patient with urinary bladder cancer has been operated at Apollo Hospital, Chennai, 5 years ago. And having information, they got some herbal materials from Bangalore and they have utilized it. More than 5 years, the patient is very much stable, except for the colostomy which he is maintaining. So, there are things which are also available. You should understand both Siddha doctors and other allied doctors and allopathy. For example, the digoxin was actually foxglove. A lady in a hut was using this for swelling of the legs, and one doctor identified, and then he made digoxin, which was ruling the heart failure treatment for more than 100 years. Now only because of the availability of RNI, there is one drug which has come, RNI, in Vaimada. I had a good experience with this for more than 100 patients. We started forgetting about furosemide. Heart failure means you should use only furosemide. That was the dictum. But now furosemide need not be used in a case of heart failure because of the availability of this RNA drug. So till such time, without digoxin, if you are treating failure, that it means you don't know medicine. That was the thing in furosemide. So such things happening with the availability of so many informations on Siddha drugs and medicinal plants. And if you go through, if you are interested, if you go through the net, which is very useful, especially in this thing, we have got plenty of information which needs to be continuously processed, so that in another 10 years, I am sure that treatment cost of cancer can be reduced to more than 1/5. Now, cancer plus, they are spending 15 lakhs. And we don't have I got a very regular patient, 25 years, and that patient had cancer breast, and she has gone to Madras corporate hospitals and all. But I have not heard from her any time. But they know they can afford to spend, but I am very sure she may not be surviving. That is the thing. And some of the people who are coming to me also telling we have spent around 15 lakhs, but nothing will be done. Because of side effects of chemo also is a big problem. For example, Sumant Raman, the famous cricket and sports commentator, once put it in Twitter some 6 months ago. 2 of his patients after surgery, they are very much well. But after going to chemotherapy, they got into trouble and they died. So now, we have got consensus, especially in Tirunelveli, with myself and some of the surgeons, if because of the availability of PET scan, now the PET scan is one of the very important modality which will tell whether there is spreading of the cancer. If after surgery, if there is no PET scan lesion, wait and watch. Don't immediately jump into the chemotherapy bandwagon. I have seen one of my own close relative, 40 years, he had colonic cancer, and after operation they are going for chemo. Chemo does 2 things. One is it attacks on the cancer cells as well as it reduces the immunity. So other things get into the trouble also. But now I will talk about it. Nanotechnology has come into the betterment to specifically work on the particular tumor cells so that the other cells are not affected. Every day we are getting some or other new information. So, next slide. So, vaccine for cancer spread prevention. This was my work. In 1992, TN and Pondicherry Surgeons Conference at Chennai happened, and I have presented 2 cases. There are a lot of discussions about it. One about vaccine for cancer, stomach and Parkinson's disease. How I am telling you, the feeling is, you see, you give for smallpox a small injection previously. Most of you may not know about it, but at our age, people will be coming and putting it in the house, and a lot of people will be trying to molt. They don't want vaccine. That was the time, but fortunately, smallpox almost eradicated for the past 55 years or so. Somalia was the last country to have the last case to be. So, what happened, while we are giving chemotherapy, some extravasation, and it has produced a form of an ulcer. That ulcer, one patient, stomach patient, operated, but we could not remove it. Dr. Arangam sir and myself was also in the theatre, that patient had this ulcer, and after keeping this ulcer, patient was all right. But patient felt everybody, guests are coming and telling why this wound. So I want immediately it should be healed. So I made the healing. Within 6 months he died. There may be some connection between it. And the thing is, the spread of cancer, stomach inoperable was stalled. Once the wound was healed, the cancer spread quickly and death occurred. Next slide. In Hodgkin disease, the same thing happened, but the patient survived 25 years. It is a record. Hodgkin, apart from giving the old drugs, MOP and all, now there are plenty of new drugs, but still she survived. I think it's a world record. 1977 May we diagnosed, 2002 May she died. With from 1980 onwards she has got no complaints. So the ulcer developed due to extravasations of chemo and listeria and developed ulcer. But at that time I discussed with one Dr. Palayamkottai, a homeopathy specialist, and she showed me in a book that a wound in the body surface, tumor growth is prevented, is mentioned in the homeopathy. So what I am telling is there are a lot of information everywhere that we will have to put in the next slide. So 1994, 16th International Cancer Congress at New Delhi, the first in India. I have presented a paper, hot coffee and leukoplakia. And WHO is now advising don't have hot drinks so that you can avoid esophageal cancer. That has been declared only in 2009, but I have presented this paper in 1994. So first researcher to find out hot coffee as a cancer producing agent. Next slide. So now we are going for an individual, we cannot discuss about everything, but one particular prototype, breast cancer treatment planning. What is happening now? Surgery, then hormone therapy depending on the receptor testing. Nowadays there are plenty of receptors and there are a lot of subgroups, and depending on the subgroups we give treatment. So chemotherapy, radiotherapy also. Modality is chosen depending on the staging. I already told you the chemo choosing also is done nowadays in big centers. That is why it is becoming costly. Next slide. But we have got a patient, 86-year-old lady with left breast cancer. Surgeon explaining risk of surgery. So the family is not interested in going for surgery. So not willing to undergo surgery. Not willing for chemo or radiotherapy also. Considering the age. Started on Siddha drug in the form of legium containing semicarpus anacardium, namely Mahavalladi legium. Next slide please. November 2021 diagnosed. Prior to that it may be there, but we have come across on that day. And treatment with semicarpus anacardium. Because of no surgery, patient developed secondaries. If surgery would have been done and this drug would have been given, possibility the patient would have better. But still, April 24, she was all right. I used to visit her in the house and there is no complaint. She was reading journals and other things and not going to any doctor or any hospital and not much of spending. So, patient expired on 11th July 2024. Only with this drug. Later we added Tinospora cordifolia, single saccharide, which is also having effect on the cancer modality. Survival for 2 years and 6 months. Almost the same like people who are undergoing surgery, chemotherapy or radiotherapy. That is the thing. If surgery would have been done, in this case the possibility patient may be still surviving. That is a very important thing. This is only what's called a model case. Next slide. Patient developed swelling of the left lower limb. So DBT ruled out by Doppler study. Vallarite tablet used for swelling. Actually, in this book, Vallarite, I have mentioned about it in the 17th number. Vallarai as a drug for this sort of things also available. Patient improved completely, no admission except the last April 24 for investigation, and no side effects of this drug also. Surgical intervention would have helped for more years. Next slide. So modern research on Semicarpus anacardium. In vitro anti-cancer activity of Semicarpus anacardium, Palayamkottai on MCF7 human breast cancer cells. Then SCF flavonoid fraction has anti-cancer potential against MCF7 cells and may be useful in the prevention and treatment of breast cancer. Volume 6, number S4, 2022, International Journal of Health Sciences. At this point, I want to point out, it is high time some of you can go into the web and create data. I already told you in the initial stage itself, more than 200 to 200 pages, small booklet which we can create. That will be a guide for making more inroads into the medicinal plans for anti-cancer activity. Next slide. So this is the one I told you. Semicarpus anacardium, a review of its phytochemistry, traditional uses, pharmacological and toxicological properties. This is done at Balaji Medical College and Hospital, Chennai. In the same way in Kanyakumari also, in another arts college, they have done some work between breast cancer and the Semicarpus anacardium. Next slide. Anacardic acid and cardinal have both been shown to have anti-cancer properties. Derivatives of anacardic acid have been suggested as possible anti-tumor agents against liver cancer, prostate cancer, and numerous additional cancers. In leukemic mice, administered SCA and milk extracts demonstrated the restoration of energy metabolism. I have used the same legium in prostate cancer also. I have used it in multiple myeloma also. Now, recently only I made out Tinospora cardifolia, which I was using, and actually I had a lecture some 2 years ago here. I was using it for substitute for CABG or stent. But this information was noted by me and we started giving, and it has got an additive positive. Next slide. Semicarpus anacardium in the form of legium, Tinospora cardifolia is powder made of capsules. Cancer, prostate, breast cancer, multiple myeloma. Or some of the cancers in which one or two are tried with positive health maintenance. In multiple myeloma, patient who was asked to wait for 3 months from a major corporate hospital, one of my doctor friend's wife. And since the disease is dormant, but she has got pain also. After starting therapy, is having no pain and painkillers were stopped. That it means it is working. And advanced cancer patient is made stable using the second drug with no need for admission. That is the next slide. So, my experience is usually the lectures will be, most of the time it will be in the book format. But I always give my experiences to you people so that you can go on with these things, and that one day you people may be having a patency on a particular drug on a cancer. That's why I was telling sir, you can have all PGs one day seminar on patency, how to do it. Because nowadays it is, you would have seen in the papers, patencies or in China it is like that, in India it is like that, in USA it is like that. The main reason is we are not given an opportunity in the syllabus to get exposed to patency rights. But it is a must when if you want to be a scientist or you want to present scientific information. So prostate cancer, multiple myeloma, breast cancer. These are all the 3 things in which I have used, and especially with the prostate cancer, he was taking our drugs also. After using this drug, patient was very stable and he has become so much alright, he has gone and started supervising a house being constructed by his son. Usually what happens, any cancer patient, they will be confined themselves in bed or they will not go out of the house. That is the thing. But this patient was going and doing the work. So always there is a dictum, how many years you are living is different. How much quality of life you are having is very, very important. And especially in cancer patients, this has got a very important point to be remembered. Then multiple myeloma, as I told you, this patient was very much stable. But unfortunately, you see, it is a full of doctors' family. But one or other, now they are going for 2.8 lakhs per week injection. I think they have finished more than 15 or 20. You can calculate the amount spent already. But still what they say, every month you give it. For multiple myeloma, it's a very, very rare disease. But the problem is, most of the time, in spite of so much of treatment available, the end result is same. So for spending so much, can he able to make the patient, as I told you, God's gift disease, 25 years patient lived. This is a record. So that way is it possible? Still nobody has got a last answer. So breast cancer, as I told you, it is one of the very important problem in India, and if dedicated treatment planning is given along with surgery. Surgery is a must because once we remove the tumor only, the spreading can be prevented. So surgery, and then nowadays we have got 3 modalities: radiotherapy, chemotherapy and also immunotherapy. But added to that, can we add this sort of drugs? And will it be helpful is a very important question, considering the cost of treatment nowadays which is going on with no adequate supportive results to a particular patient. See, we can give statistics, but to a particular patient, can you assure? It is very difficult at the moment. Next slide, please. So, Dinospora cardifolia, I think some 1.5 to 2 years ago, I gave a full 1 hour lecture on this. Where are all I am using? I am using it as a substitute for CABG, PTCA, and also in a diabetic foot, when there is a block, you go for an amputation, toe or leg. But unfortunately, recently I got 2 youngsters, one teacher around 40 years, he had lost his leg, diabetic, and another one also. That may be the reason being, nowadays one drug is used in diabetes, which has got, originally in America they said it should not be given because it has got an amputation potential. But now with the heavy marketing technique, every doctor is using that drug. It ends with the dapagliflozin and like that. But even the first time itself, 7 years ago, it was introduced, I told the people I am not very much convinced about the mechanism by which it is being used. But I hope this needs to be remembered by you people also, because a lot of your relatives may be having diabetes. This dapagliflozin group have got a very unique thing. The sugar coming out into the urine is not going back to the body. So because of that, more fluid is coming out, more electrolytes are also coming out, and that produces lot of dysregulation in the electrolyte and metabolic balance, and that can produce lot of side effects. Mainly in women, it produces urinary tract infection often, and amputation is also a possibility, but it is not very much focused because always nowadays the commerce took over than the reality. And I hope I am the only one in the world or in the Tamil Nadu not using that particular SG to L2 inhibitors, because of I feel it is not a correct approach to diabetes out of my experience for more than 45 years in the field. So, then multiple myeloma, breast cancer. In these 2 things we have tried, but not in prostate cancer. So, these 2 drugs combined, even if you give it to a patient who is in an advanced stage also, there are a lot of side effect problems, symptomatically it can be, improving. Now, one of the very important problem is advanced cancer, because more than they say 30 to 40% of our patients reach any doctor only during advanced stage. At that time, it is very difficult to manage them because we don't have a dedicated palliative care in India. There are a lot of articles on it in Indian Express recently. Next slide. So, I think the time is running more, but anyhow I will finishing my 45 minutes work. Thick fruit and CML. This is a very important thing because in chronic myeloid leukemia, as I already told you, leukemias, there are plenty of subdivisions now. Previously, it is chronic myeloid leukemia and also acute myeloid leukemia, and we have got ALL and CLL. Always in MBBS, when somebody is going for examination, you remember two things: garden party appearance or convent party appearance. A slide is given and you are asked, what is the possible diagnosis in an examination? Garden party appearance means varieties. Lot of flowers with different colors. In school uniform, it will be always same. So that way you have to, CML has got a garden party appearance. So it was, there are a lot of very minimal drugs were available till 2000, and now we have got plenty of drugs. Patients' lifespan increased with less symptoms. Now cost of treatment is well known. One drug which was costing 1,40,000 per month, because of a port interference, now it is costing 8,000, 7,000 to 8,000. I myself gave one of my patients, because it is 1,40,000, the pharmacist gave it to me and asked me to give it to the patient in ESI hospital. So it is not directly I got involved. And now another drug has been introduced, that is costing more than 1 lakh. Imatinib and like that. And good research area, this one, because while I was going through the Athipalam in Gunabadam, there is a word which struck me. That is, it has got something related to blood related thing. So it is like Pudina, if you go through in Gunabadam, they will say, Kurdi Alukai Kedukam. The very word. You'll have to interpret in a different way. Kurdi Alukai means cholesterol. See, in Ramzan, if you go through the marketplace, you'll be knowing plenty of Pudina will be sold out. Especially in Junction area, Kanamangoil Street, if you go the rare day of Ramzan, you will see plenty of Pudina. So Pudina is very good generally, but people have done a lot of works on Vendayam and cholesterol. And even some popular speakers are talking about it in YouTube. But nobody gives importance to Pudina, as far as I know. But it has got the very word, Kurdi Alukai Kedukam. If you go to the Gunabadam, because I am in conversation with Gunabadam for more than 30 years. Even recent edition, in spite of same thing, and I am having a new one also. So this now previously this fruit people will have to search and they will have to find out from villages. But now if you go to any supermarket, they have got plenty of fig fruits. Even from Arabia and other places, they have got in Smart Bazaar and all, plenty of fig fruits are available in varieties also. Taste also differs. So the CML, why I am telling you is, one person who is getting treatment from Cancer Institute Adayar came to me because I have written an article on this at Dinamala. So he is being subsidized. They are making a group and then subsidized. In spite of that, the drug cost around 1 lakh below. So how many people can afford in our country? But wherein this Athipalam, it is not very costly. Even the very good quality Athipalam costs 300 and all. Ordinary thing, it is cheaper. If you go to Aryas and all, I am not advertising, I am telling where it is available. It's not very costly, 50 rupees, 100 rupees. So this is an area, because I am telling you, plenty of opportunities are that in this, and this one has got a very simple also, no side effects. Everybody knows Atipalam, if you are taking, it's not going to create problems. Next. So, in short, I am finishing my lecture, and if there are any doubts, you can always ask. Still, there are a lot of information available which I am not bringing it because it will be boring. I am telling the needed information for you to stimulate your minds to work into your own area of medicinal plants and trying to find out what best you can help these unfortunate people who are suffering and also spending. And I think Professor Kumaraswamy's book can also be gone through by every Siddha medical practitioner and student. I am not remembering what he has told because it was more than 30-40 years ago I read it fully. I would like to once again have a copy and review. And fortunately then he became Tamcol chairman, first chairman if I am correct. But this is a very thought-provoking book some 50 years ago. That is a very important thing. Rather I can say he thought over as a pioneer how many medicinal plants may be useful in oncology. That's a very appreciable thing. So numerous studies have demonstrated the efficacy of herbal plants in cancer prevention and treatment. There are plenty available in These plants may offer promising therapeutic benefits by modulating various cellular pathways involved in cancer development and progression. Further research is crucial to fully understand the mechanisms of action of these herbs and develop safe and effective herbal-based therapies for cancer. It is like the Siddha is our own heritage, or rather, for example, a lady, her own child, she will look into it properly than the other child. So in America and other places, they look into this traditional medicine, but their approach is more of developing something which may be commercially possible to think. But our aim is to help our own very poor but cancer affected individuals to make them better in the whole of thing. So our approach should be more specific, and I hope in the long run, with the coming up of Siddha University soon, there should be a separate branch which should be completely working out on this. Actually, I told in this book also, the Vallara itself requires a separate department. Because I have compared Gunapadam also in this book. It contains more than 15 new indications. The same way, Tinospora cardifolia, I told you I am using it for 30 years, but I don't know it is anti-cancerous. And recently only I came out. Like that, even recently I think another product in which semicarpal anacardium is there, that has been useful in cancer, has been presented at Madras, if I am correct, as per the paper. So, next slide. So in short, my aim of this lecture, for which I have been invited as a guest speaker, is a very great honor and a very big opportunity to share whatever I have done for the past 30 years. I am from the beginning, I can say I am a fanatic to find out whether any good drug in cancer which can help lakhs of people. That was my view when I was a medical student. But now you see everywhere, even in Tirunelveli, I think there are 3 or 4 cancer big hospitals come up, and 5th one is coming nearer Mulakarpati, going in Nanganeri nearer. So such is a demand and such is a problem. So if we can help these people with surgery is a must in most of the cases, plus chemotherapy or radiotherapy or immunotherapy or the alternate medicine system is a very, very important thing, and we are at crossroads. It is our inborn duty to think about it, and things cannot come just like that. You will have to dedicate yourself. So money earning is one part of it for a doctor, but creating new information is a real pleasure. Once you do it, you will know the pleasures of that. So it may not bring money. A lot of people used to say, you are putting this book, how much you are earning. No, it is not a question of earning. It is a question of showing your intellectual prowess. What others cannot do, you can do. Itself is a great reward which God has given you this much of knowledge. With these few words, I hope I have communicated to you people, youngsters especially, lot of information which should stir your mind to work on this area and to create lot of patents in the long run to come. Thank you for Professor Hariharan Mahadevan sir for giving me this opportunity, and thank you for all of you who have had a patient hearing. Thank you very much. If there are questions, you can always ask.
டாக்டராமே தப்பாக நினைக்கக்கூடாதுன்னு அந்த கேள்வி கேட்குறேன்னு. நீங்கள் சொன்னதுலேயுமே கடைசியில் ஹெர்பல் பேஸ்டில் தான் நீங்கள் வந்து நிற்கிறீங்க. ஹெர்பல் பேஸ்டு ஆன்டி கேன்சரஸ் ட்ரக்ஸ்ன்னு தான் உங்களுடைய ஸ்லைட்லேயே நீங்கள் there are many herbal medicinal plants herbal based. Why should not we try integrative ஒரு மெட்டல் மினரலோட ஒரு விஷயங்கள் நிறைய எங்களதுல நிறைய ட்ரக்ஸ் அது மாதிரி இருக்குது. லிங்கம்லாம்
இல்ல what I am telling you is that's what I am telling in another thing. What I have tried and what is my experience, that's what I am sharing. See, I am not a Siddha doctor. I am a person who is looking into the books available and try to identify whether there is supporting, because as an allopathic doctor I cannot use it straight. Somebody questions. So I have gone through the website, and for example, Semicarpus anapodium is useful in multiple myeloma. There are papers. See, with my other academic works also, I am doing this, and that's what I told you. Go through the website and you can create 200 pages information on various herbal plants. Not only that, see, I hope there is one lecture afterwards, Sir's lecture on Kayakalpa. But I don't know much about Kayakalpa. See, as an alternate medicine doctor, compared to Siddha, I am an allopathy is an alternate medicine. I have gone through with my own experience what is the information fed to me through the website or through the books. See, I have not gone through the Gunagadam A to Z. It is like a dictionary for me.
சார் நீங்கள் ஒரு வாய்ப்பு இருந்ததுன்னா எங்களுடைய குணப்பாடம் செகண்ட் அண்ட் தேர்ட்னு பார்ட் அடுத்தது இருக்கு, அதுலேயும் பாருங்க. யூ வில் ஹேவ் மெனி அதர் இன்ஃபர்மேஷன்.
See, for every month, I think 555 plans are described. But I even told in the last lecture, if any one of the students can take up one thing, and for example Agathiyar, and you can go through the net, and I have done it, it is in my computer, more than 100 pages available on this, and if they can make it some 20 pages, I am willing to even edit. That's what I told last time, but there was no response. Youngsters should do it, understand? So what I am telling is, even this book was ready by November. I could not bring it out due to so many other commitments. Today I thought this is the ideal time to bring this book to the audience. So what I am telling is, youngsters, I told one student, PG student, one drug. 555 or 58 drugs can be completely made into a very big encyclopedia within 10 years. These things should be done by youngsters. See, we are here to guide, and we are here to tell what is what. So as I already told you, there are big conferences wherein most of the professors will vomit from books. But my usual approach is, I tell what I am doing in my practice day to day. In that sense, I have used, I told you, Dinospora cardifolia, single circular, I am using for 30 years. Even 12 years after the CABG advice, people lived. The unusual thing is, a person who had recently a stent and he died within 6 months. He needs another stent but was not done. He recommended a person from Pondicherry for this CABG equivalent and he is living for more than 3 years. He has not undergone stent or CABG. Even yesterday, they used to send him money and we asked them to send the drug. Why I am telling it, but the same drug is useful in cancer is well known to me only in around 24th beginning. Yeah, it's a very vast, you see, as it is, Tamil and Tamil related Siddha are very, very vast area. Even if you go through Tamil details of the books, in lifetime you cannot read everything. You can only concentrate on one thing. For example, Justice M.M. Ismail was concentrating only on Kambaramayanam. Even in Governor's Bhavan, I recently heard 9 volumes of Kambaramayanam has come out. We may be able to read one or even Thiruvalluvar. It's a very big ocean. Tolgapiyam, Marabiyal is a very big thing. Now we talk about zoological classification, this and that. But Tolgapiyam, Marabiyal, I have written a book, but I am yet to publish it for so many reasons. Why I am telling you, there are plenty of things in a lifetime. The difference between foreigners and ourselves, they concentrate on one thing and they definitely get the name. For example, mRNA vaccine is now available. When the made out, one lady was ridiculed 10 years ago in USA, not here. But the same thing is used for coronavirus vaccine. So the time also will have to come for us to bring it out, and everything cannot be done by a single individual, but we can do the best. This is only a bird's eye view. What I have found out, see, first thing, I approve 100% about Siddha drug. That is a very important thing as an allopathic doctor. How many of the people will come out, I don't know. Because there is a big war going on in Twitter about Ayurveda and allied thing. One liver doctor from Kerala is very much ridiculing about Ayurveda, thinking that he is the ultimate. No, nobody is the ultimate. Even a doctor with so much of experience, now I am running on 48th hour, 77 I have finished. You can understand. But still, as usually told about Lord Saraswati இன்னும் கற்றுக்கொண்டிருக்கிறாள் அப்படிங்கிறதுதான் ஒரு information. அதே மாதிரி in medical field it is very big. So I am not biased. I am very clear about what I have to. Okay. Anything students can come out with some questions so that the next question sir is waiting. If there are no questions, thank you very much for the audience.